We'll move on to the next session. It is a lecture series on innovations in improving access to TB care. For this session, I would like to call on stage moderator Dr. VK Chadha. I'll also request the speaker for the session, Dr. Sreenivas Nair from Stop TB Partnership. So if you could come on stage.
All right. So let me at the outset welcome all of you to this very important session. Innovations in improving access to TB care. Important because a modeling exercise has shown that improving access to best available care will have maximum impact on incidence and mortality. So I have the pleasure of also welcoming my friend Dr. Sreenivas Nair. Dr. Sreenivas has been one of the major contributors to the continuous evolution of the TB program in India that we have witnessed last 25 years, and he continues to do so in his current capacity as the senior technical advisor at Stop TB Partnership. So without taking much time, over to Dr. Sreenivas.
Good afternoon to all, and thank you, Dr. Chadha, for that introduction. I won't stand between you and lunch, so don't, be worried. I will make it very quick because my job has been made very easy by the number of presentations and also the panel discussions. I hope that some of the innovators are still here in the audience. Will really share some dreams I have for innovations for TB in India. I mean that when there is an innovation of TB in India, then that is basically the global good which takes to the global level. And at Stop TB Partnership, we are always excited to take those innovations from India to the global level as a global good. This is just that, we have this, the cycle of from a normal person to going through the various stages of tuberculosis. And these are different stages in which we can make innovations impactful, whether preventing a healthy person to get latently infected, or one who is infected to become active disease, or from the disease to the diagnosis and treat and all these cases. And I have not gone to the top floor, so I have not that wise. I am sure that in the afternoon I will go there and I will become wiser to give. And so this presentation is not going to be very comprehensive about TB innovations as such. But we know that to end tuberculosis, we need a number of steps. It is not just about the diagnosing and treating. Yes, we need to diagnose and treat people. We need to diagnose and treat people early. We need the existing technology, the innovations to diagnose and treat TB infection. Of course, the nutrition is an important component, and then finally the vaccine. If you really want to bend the curve in that sharp fashion, we need to do all of them well. We'll just make some points on the missing millions and also the delay challenges we know. There are different reasons. I'll not go into the details, but the suboptimal healthcare seeking is one thing. Many times we talk about missing millions, and these millions are probably missing from us. They are not missing us. They are not going to come to us. So the innovations need to be how to reach to them and make those diagnoses happen and treatment and the care happen. We have discussed about this, the missed from the diagnostic by design, the asymptomatic TB. Dr. Soumya has, presented that in the morning. And I also wanted to just mention that an important opportunity of innovation or basically research, she has mentioned in her presentation the need for, we don't know what are the real, what happens to the subclinical TB to a large extent. A lot of modelings have been done, but the real-time story is yet to be revealed. In India, we have an excellent opportunity. We had the largest national TB prevalence survey done in the world, and I don't think that the world will see that sort of nearly 400,000 samples in the population, detecting nearly 1,000 TB, and of which around half of them, at least there is 450 subclinical TB available to you in the program, in the country, and all the details are there. So even we do now, it is still not late. I would say that if you can still go for a retrospective cohort analysis of that particular cohort, we would really know a lot about the fate of subclinical TB. So these are the research and innovations I think we can again support to the world. Yes, of course, we have discussed a lot about the problem with the diagnostic, the screening, the insensitivity of our diagnostic tests. So, but then, as the panelist earlier has also mentioned, we have gone through a long, from the past to the present, and the future is looking much more brighter. And I'm sure that we will know more about it. I'm not going to go one by one, but then the future, definitely the cuff app are definitely going to be very, very interesting. It's a point of care screening test. A non-sputum-based test we have discussed, and of course, better point of care is absolutely necessary to reach the last mile. There are also shorter regimens coming up. 1 month regimen, we also heard from the panelist about the potential for, long-acting injectables as anti-TB drugs, etc. I would just mention something about this because we will be also seeing about the interesting about the cuff AI. We know in asymptomatic TB, many people will say that, okay, if there is no cuff, then what is the importance of cuff AI? In asymptomatic cases also, there is when we are looking at the cuff as a symptom and cuff as a biomarker, there are some distinguishing features which we need to understand. As a symptom, it is definitely not a very good sensitive tool. We know that, the sensitivity of just using cuff as a screening is only maybe 50%. But when you use it as an objective recording, the sensitivity can be more than 80%. It also gives, there is an active measurement, unlike a passive cuff as a symptom. When you are using it as a biomarker, it has got opportunity to measure it because the AI intelligence is much more there. What they hear, and AI, human hearing even with our stethoscope has got a limit. We all know, but the dog has, and they have got different spectrum. But the AI has got a much bigger spectrum, and that learning which an AI algorithm can keep on learning is going to be much more smarter than the human intelligence. It is already there, and it is definitely going to be very important when we are so-called, we old people, we like to criticize the new things, but nowadays we know that 19-year-olds are going to decide the fate of the world. So we really need to be more receptive to this sort of ideas, I would say, in innovation. There are many such tools available, and most of them are the Indian tools, and there has been a lot of discussions. Please go and have look at some of those innovations with an open mind. I would definitely, we have discussed about this point of screening test. Again, it's an Indian innovation where you can do the blood test to know how good the TB test is. And again, when we are obsessed with validation, please understand any test which is better than the so-called gold standard will have its own challenges in validation. And we need to have smarter ways to make those validation useful. Otherwise, we will go in cycles. Yes, we all know about it. I will not really call it as an innovation now because it is already there for quite some time and the people have been very smartly using it. But I will take a pause here to really talk about how these innovations need to reach are really good tools to reach the people in the last mile. This slide is very fresh. This picture is a very fresh one. I could do it yesterday. I went to the field with some of our friends from Humana for People, and they are working with the most disadvantaged group of people who don't even have an identification card. They do have identity as a human, but they don't have an identity as a national. They are in the streets, they are in the shelter homes, in the most difficult places in Delhi. The number is not small. It's around 200,000. Okay, and they have a very high TB rates, and we do have got the people working with them, their own people trained and working with them and trying to, through TB, it is not just they started with the TB, but then they are able to enter into their life to make it better. So why I want to say is that this is an example of the importance of people to take these tools to the needy ones, and that is where the last mile. All this active case finding efforts, which we know about, this all is been happening everywhere, is a way to reach those people who are missing us, right? They don't really miss us, but we are missing them. So to reach them, we need to use these tools. And as we really know, a high sensitivity tool like a digital X-ray with the support of artificial intelligence is a very useful one at that one. And there are some of those examples in the Stop TB. We like to popularize it by taking it to the base camp of Everest. And you can actually see that if you can do X-ray at the base camp of the Everest, probably we can do anywhere. But we know that it can be taken in the boats, and we have got some projects even in Rajasthan where they are actually going into those desert in a camel cart. And this is what I will say, that making access to the people. How do you take these innovations to the people who need them? I won't talk about the diagnosis. We had a big session on the diagnosis, but I will also say that this new India innovation, the SciTB test, is now available with the Stop TB. And as I already mentioned, Stop TB partnership, we are in partnership with the India Health Fund also, so that we support the innovations. But at the same time, any innovations comes, we also use this opportunity to take it to the global level. Whether it is with multinational validation, we support innovators to do country validations, to develop enough data to get the WHO global approvals and other funding agencies like the Global Funds Expert Review Panel recommendations. And then, of course, we do have got advocacy with the countries and also with the donor agencies to ensure and projects which makes these new tools accessible to other countries, just I was mentioning on passing. In the treatment, we already know that there are newer regimens, and the BPALM regimen has revolutionized the way that we are not just the treatment of drug-resistant tuberculosis, but I think a paradigm shift in the way we look at drug-resistant tuberculosis. Drug-resistant tuberculosis for the last 2 decades has been something like, very difficult to do. It is a super experts area, so better not to touch it. And if you touch it, it's really painful, because yes, it was painful to diagnose, painful to treat, painful to watch the people die and suffer. Now that has changed. That has changed into 18,000 pills coming to like 450 pills, okay, 6 months of treatment. And I would also say those who are climate inclined, that these are sort of some of those innovations which we can talk to the climate people that, okay, you give us money, we can make our own interventions, the health system, climate friendly, while changing 18,000 the pills of the old MDR-TB regimen to just this 450 pills. In the current regimen, we are reducing the greenhouse gas emission by around 96%. While changing from the sputum smear microscopy to a point-of-care test, we are reducing the greenhouse gas emission globally by about 93%. So these are big things. The TB innovators have actually shown that this can actually make a good argument for climate-friendly interventions also. We have, as we already know, that there are many vaccines available, but these vaccines, I will just only mention about one thing. The India had again an innovative approach to do BCG vaccination to the adult population in India. Many people had raised their eyebrows. What the hell are you doing? But a lot of people, and including me personally, was very excited because this is an excellent model of how we are preparing ourselves to do this vaccination at the community level. And we have just tested it, and I am sure that there is a lot of learnings from that experience and the confidence the program has acquired that the moment you come up with any vaccines, we can cover the entire population. So this is the sort of a model which other countries also need to be ready, because even if you have vaccine, as Madhu said earlier, you have a vaccine, but if it is not accessible to the people, then it's of no use. We know that there is now compelling evidence about the role of nutrition. That innovation has also gone from India, from the ration trials, and we have done a model just to see that, what is its impact. If the data from the ration trial, we used to make a model to see that if you cover the population of India with a good nutritional support from whatever the sources, and of course from the various sources, I should say, that you can reduce the incidence by 12% and 18% if the coverage is 60% or 90%, which much affordable cost range. So it's again an Indian innovation, which I would say. And the last, there are many digital platforms which we have discussed, and including the AI and other programs which we have discussed. Anyway, I have less time, but then I will just say one thing we have again. If you can't fly, you can't walk, you can fly. The drones which you have mentioned, there are different projects, and even in India, we are using the drones to not only carry the samples, but also to carry the drugs to the difficult to reach areas. I have just one last point to mention is about, there are various questions in the program, and how do we do, what we do, where we do, and these questions need to continue. As one of the panelists has rightly mentioned, the TB epidemiology in India and the problems and challenges are not same. So one shoe does not fit for all. The strategies need to be, again, keep on changing, real time. So what do we have? We have the best data system for tuberculosis in the universe. There is absolutely no doubt about that particular system. And it has got, I am one who actually almost every working day, the first thing I do is that open Nextshare and see, what is the notification today, because I know that TB notification is the earliest and the most, precise an indicator to see that where the program is going. And India just put it for everyone in the world to know what is the notification happening, not only at the national level, but also at the state, the district level, public, private, separately. There are so many dashboards and so many analytics available here. So the questions which I asked, whether a state TB officer, whether a district TB officer, whether the national TB program manager, at any point of time, we are sitting on a gold mine of super data, which you don't have anywhere else in the world. However, are we using that data sufficiently? There are so many data. We know that there are so many users here. And that is where this is another dream I wanted to share with you. A lot of my dreams, most of my dreams about TB has been fulfilled by India and all of you. So this is another dream I wanted to share with the smartest people on earth working on tuberculosis here, is to have a Nextshare guru. You can give whatever name you want, but this is my name. you have this excellent system, as I already mentioned about the Niksha, with from the screening to the continuum of care to the Nikshan Poshan Yojana, the DBT data. We have all this TB Mitra apps and so many series of data available, the laboratory data, drugs data, and again the call center, Nikshay Samberg, and so much of data is even in that one. What can we put all those data warehouses together and put it into a Nikshay AI engine? We can have, again, club it with the climate data, club it with census data, and so much other open data and model data and other epidemiological data which is available in the country, from even the lay community data, one impact from the community response data. You can have, again, newspaper data. So all of them are available, and how smartly we can do it. We can do it in two ways. Start with the machine learning, which we will see that many of them are coming, but which definitely need to get into a deep learning neural network where the real AI, which can actually see these patterns much, much better than what a human can do. And that is where, and it is also not really that challenging with the availability and the thrust government of India is pushing towards for AI. And I hope that we can really get to there. And I would just say, in the next innovation summit, when we meet together, we will be presenting the Nikshay Guru. Thank you so much.
Thank you, Dr. Sreenivas. I am sure there are many take-home messages which we need to take back and see how we can implement and integrate those in our current TV program. If I may summarize, Dr. Rakesh, in 1 minute, I would like to use some keywords for Dr. Sreenivas' take-home messages. One is best care, available locally, and we need to have feasible solutions which are practical, which are also cost-effective and high impact. Well, we should not forget that in India, 38% of the population belongs to key vulnerable populations, and they contribute something like 68% of TB incident mortality. So prioritization of innovation and access to these populations. And of course, he also talked about the innovation and the need, and Dr. Madhu also spoke about vaccine, which is primary prevention. But one thing which I would like to add, Dr. Sreenivas, is that we also need a test which will tell us that of the infected, who are the ones who will break down into TB, which I think has been missing from our armamentarium so far. So maybe that is one which will add to our resources, which will aid in faster TB elimination. So with this, we thank the organizers for giving us the opportunity. Thank you so much.
Thank you so much, sir, for this wonderful moderation and this wonderful panel lecture. I request Dr. VK Chadha to hand over a memento to Dr. Sreenivas.